The MK Mental Health Hour with Arthur Ellis Mental Health Support and MKFM.
It's just gone 7 o'clock on your Sunday evening. Hello, it's Leah with you for another MK Mental Health Hour. This evening we're discussing depression with Dr. Raj and John from Arthur Ellis Mental Health Support, and we continue with the tune Sigrid lined up after Jonas Blue. It's Rise now on MKFM.
The MK Mental Health Hour and MKFM.
Jonas Blue and Rise on MKFM. Good evening, it's Leah with you for another MK Mental Health Hour, and as always I'm joined in the studio by John from Arthur Ellis. Hello John.
Good evening.
Good evening, lovely to see you as always. So you join us every single Sunday at 7 o'clock and we discuss a variety of mental health topics in kind of a safe space, and we always have an expert with us this evening. We have Dr. Raj. We're going to be talking all about depression tonight, but before we get into that, any updates from Arthur Ellis? What have you guys been up to over the last week?
Oh, we've been up to an awful lot. So we have as people might not know, we have corporate training. So we help people within organisations to improve the mental health of the organisation. So not necessarily just signposting, but how do we actively support other members of staff and our colleagues. So we have this week, there's been 5 new companies, and which has been amazing. So really, really good. That's an awful lot of people that we're able to support all at once, which is brilliant. And then on the one-to-one stuff, we support children, young people, adults, and our aim is to build a free support service for children across Milton Keynes. And we've been getting about a referral a day. So that's been Rita, who's been on the show. She's been absolutely incredible. Working her little socks off.
Well, shout out to Rita. Well done,
well
Rita. And well done to you and the team. And if people do want to support the work that you do at Arthur Ellis, can you give us your website details? Yeah,
so that's where all of our guides are. That's where information about our services is and where you can self-refer. So we have a week turnaround for appointments as well. So we don't really have a waiting list. So that is www.arthurellismhs.com.
Brilliant. And we'll make sure all of those details are available on the podcast section of our website, mkfm.com. So this evening we're going to be talking all about depression, and actually, timing-wise, there might be a few people that do feel a little bit kind of sad and maybe a bit depressed this time of year. Blue Monday is looming tomorrow, isn't it?
Yes, so Blue Monday is tomorrow. I don't know whether anyone might be able to tell us this if they're listening, but I feel, I probably should have looked it up, but I feel that it is just a marketing ploy that happened way back when, and now all of a sudden it's latched onto, and everyone is anticipating being depressed on a certain Monday in January.
Yeah, and I mean, it is that time of year, isn't it, where people have maybe overspent at Christmas and payday is still so far away, and you've maybe gained a few pounds and you've fallen off the bandwagon of New Year's resolutions and all that kind of hype. So there is, a bit of a pressure, and it is quite a difficult time of year for a lot of people anyway.
There is, yeah. There's loads of stuff that people are carrying from Christmas, from the break with family, which we had a look at in last week's show as well. All of the different stresses and strains that come along with that. So it's kind of a time where all of these might be getting on top of you a little bit.
Yeah.
And if we're looking at depression and sort of that embedding in somebody's life, it's kind of quite a good time to just help people look into themselves a little bit, figure out what's going on, and then throughout the show we'll be able to have a look at what avenues of support are available and what people can do themselves to try and break that cycle.
Absolutely. And to help us on the way in the show this evening, we've got Dr. Raj. Hello, Dr. Raj.
Hi both, how are you?
Very well.
Excellent.
Thank you for joining us again, because we did do a show before all about changing seasons, didn't we, with you? And if anybody missed that, again, available as a podcast at mkfm.com. But we're talking about depression this evening. As a GP, how often would you say you see depression?
Unfortunately, Leah, we see it all too often. It's the 3rd most common illness that we'll see in general practice.
Wow.
So is that physical and mental, anything, everything?
Well, they estimate that around 30 to 40% of all cases that we see in general practice have some mental health element to them. But around 5% of the population will experience a diagnosed depressive episode at some stage in their life.
And we had a little chat before about whether you can fully recover, what are the options of, or what's the likeliness of having it again? Is it going to be something that reoccurs? And you said some really interesting stuff.
Yeah, absolutely. So unfortunately, if somebody does have a diagnosed episode of depression, there's a 50% chance that they'll have a second episode. And that chance effectively doubles each time. So if they have a second episode, then around a 70% chance that they'll have a third, and so on. So it's so important for GPs particularly, that when somebody presents to us with low mood, that we do try and establish that have they had a previous episode that perhaps has gone undiagnosed, because it really helps us guide how we're going to manage their current episode.
Okay, well, if you're listening to this and thinking, oh, this sounds a little bit familiar, or maybe you know somebody that's maybe feeling a little bit low, we're going to get a better understanding with Dr. Raj about what depression actually is after we hear from Sigrid. This is Don't Feel Like Crying on MKFM. Loving that here in the studio. Sigrid and Don't Feel Like Crying on MKFM. It is the MK Mental Health Hour. Tonight we are talking about depression. Blue Monday is tomorrow. We're pretty sure that it's a myth, so don't make you feel like you need to be depressed tomorrow. But we're talking about the differences now about having depression and maybe having a sad period of time. And there are differences between them, aren't there, John?
Yeah, there's quite big differences. So it's kind of like with any mental health issue, whether you're talking about depression, whether you're talking about anxiety, if there's something that's situational going on in your life, that is obviously going to have an impact on you, whether that is a bereavement, whether it's a divorce, might be a really stressful period at work, that's going to have an impact on you. But it doesn't necessarily mean that you have a diagnosable issue or a mental health condition. So really what someone will look at when they are looking at someone who's presenting with something similar to depression is that it needs to kind of tick 3 boxes of impact to that person.
Right.
So if you're feeling sad for a couple of days, or you're, obviously if there's been a bereavement, you're going to feel sad for a period of time, but it's really having a look at whether that sadness or that feeling of depression is beginning to impact other areas of your life. So that's where it kind of starts differentiating. And Dr. Raj, in Arthur Ellis, we don't diagnose, we're an emotional support service, so we don't do anything clinical as such, so we don't diagnose people, but certainly we use kind of those 3 principles to see what impact it's having to someone, to see how we can support them best. So it tends to be psychological, biological and social. Is that kind of the areas that it tends to fit into? So the biological issues will be their thoughts and what's going on with their mind. So that might be where someone starts experiencing issues or thinking differently, and then it starts having an impact on the others.
Absolutely. So it's a good place to start. And as you quite rightly said, is that there can be a whole bunch of triggers in our lives which can trigger low mood. There are certain things that aren't sort of immediate triggers that can also make us more susceptible to depression, such as suffering from chronic illnesses, poverty, joblessness. And so it's really important for professionals to understand the context with which somebody presents with these symptoms. And when they do, absolutely, as we've learned at medical school, we do go through a checklist which includes those aspects of psychological, biological and social impact of the symptoms that you're having. Typically, a GP would ask you questions around your sleep pattern, your appetite, your concentration, your ability to enjoy things that you would normally enjoy, and also then about more of your psychological symptoms around anxiety, agitation, which can sometimes happen. And in some more severe cases, people can hear or see things that aren't necessarily there. So a GP will ask you a full array of questions, and they're trained to do that to try and establish where on that spectrum of low mood somebody is. But giving them that context of, has this happened before? Are you suffering from any chronic illnesses? Or are there any other considerations that they need to make about your life which will help them make that diagnosis of depression rather than just transient low mood?
And that'll also help the course of treatment, I suppose, as well. So what direction is going to be suitable for that? I don't want to necessarily patient, because patient, I don't really like the word.
Well, that individual.
Yeah. So what course that individual needs to make. So is talking therapies always relevant? Is medication always relevant?
So that's a really good question. If we know that this is a first episode of depression, then we're more likely to try talking therapies, trying lifestyle interventions. If we know there's been an established episode before, we're perhaps more likely to try medication as a route along with talking therapies. So yes, it does change our view as GPs on how we might treat somebody. But the great thing about being a general practitioner is that we have the opportunity to get to know our patients, get to know their families, and see them, often just episodically, and that in itself can be very powerful in helping us establish the right journey for the individual.
So with if someone is going through something that is difficult, so like a bereavement or like a divorce, something like that, we kind of set 2 weeks as a bit of a barrier to this isn't necessarily just sadness anymore. Mm-hmm. Is that fair to say? Is that kind of how a GP would look at it as well?
Absolutely. So if you've gone through a stressful episode and you're experiencing symptoms or feelings of low mood, anxiety, and it's going on for a couple of days, we advise you to be aware of it and be responsive to that. So maybe try some self-care. That you can get information on online, and we'll share that with you later in the show. Beyond that, if you're getting persisting low mood and it's carrying on for around 2 weeks, then it's the right time to start thinking about, should I go and see my GP? Are my thoughts, are my feelings, is my mood started to be affected for a period of 2 weeks or more? Absolutely. Come and see your GP.
And we're going to find out more about when and what you can expect from seeing your GP, all to do with depression, after we hear from David Guetta. Don't Leave Me Alone plays for you next.
The MK Mental Health Hour with Arthur Ellis Mental Health Support.
David Guetta, Anne-Marie, Don't Leave Me Alone on MKFM. Good evening. It's Leah with you for another MK Mental Health Hour. This evening we're talking about depression. I'm joined in the studio, as always, by John from Arthur Ellis Mental Health Support and Dr. Raj. So just in case anybody missed it, a quick recap on when maybe we should be considering going to the GP if we feel like maybe we are depressed. You mentioned about there being like a 2-week window.
Yeah, so if you've been sad for a couple of days or so, then that's completely normal. But if it starts dipping into that 2-week period where you have been experiencing a difference in your concentration, maybe your sleep, your appetite, different social things, so maybe you've recognised that you don't want to see people as much, or you're not talking to people as much, and you're kind of isolating yourself a bit. If that's really hit the 2-week point, then it's certainly worth beginning to consider going to speak to your GP about it. And like we said in the very first part of the show, GPs see this really, really regularly. So they're going to be really familiar with being able to understand what's going on and get the right support in place for you.
Okay, so if people are listening to this and thinking, okay, well, I might be thinking about booking a GP's appointment, there are actually things that people can do before actually coming along to the appointment, aren't there, Raj?
Absolutely. And one thing it's really important to point out, there's lots and lots of press and media around the challenges in accessing general practice. And it's quite right, there are conditions that we would not like to see, such as self-limiting conditions, sore throats, mild fever, upper respiratory infections, and so on, that can be captured and dealt with themselves. However, with depression, we do want to see patients who are suffering from these symptoms.
Yeah.
We do make time to see these patients, and in fact, the NHS generally is trying to make a shift towards allowing GPs the time, often 20-minute appointments, to see patients with depression. And when we see them, individuals with depression or depressive symptoms, we are going to ask some questions. So I guess it would be useful to know what those questions are going to be around, so you can start perhaps beforehand. So you can even start being more mindful yourself as to, how is this affecting my sleep? How is it affecting my appetite? How is it affecting my mood? How is it affecting my interest in doing things that I would normally like to do? And if you can record those over a few days, it's really, really helpful during that first consultation.
So you'd suggest to maybe keep a bit of a diary of how you're generally feeling, your appetite, your sleep, and those kind of things that you just mentioned.
Absolutely.
So then if people do then come along to the appointment with all of those things written down, what are the other elements and questions that a GP might ask?
So as I touched on before, we'd like to put it into context. Have you had these episodes before? Have you had a recognised diagnosis of depression or low mood? Is there a family history? Your social circumstances, what are the triggers for this episode? Have you lost your job recently? Are you going through a difficult time with relationships? But also, we will know a little bit more about your chronic conditions if you have them, understanding what support structure you have around you. So do you live at home with someone else? Is there somebody that you can talk to? These are all really, really important questions that we'll ask you. One of the most prevalent things that I find in general practice, and this is a question that can often throw patients off is we will often ask you if you've experienced darker thoughts.
Okay.
So thoughts about ending your life, or really trying to harm yourself in any way. And it's very important that we do ask those questions as a GP, because it's very important we capture people who can experience those symptoms. And often with episodes of depression, people can episodically experience those symptoms. Our job is not to lock people away, it's to try and do a kind of risk assessment, try and understand how important is that dark feeling, how is this person managing it, what support do they have around them, and how would they cope if those dark thoughts were to become more prevalent.
And then I suppose to be able to diagnose and understand the best way to kind of help them and support them on the next part of their journey.
Absolutely. So we do take all of this into consideration, but please don't be put off by your GP when they ask you that question. We're doing it because we think it's a really, really important question to ask.
And being suicidal, in inverted commas, isn't necessarily having a plan in place or have really sort of planned anything out. That's something that has got to quite a severe point. Suicidal is just having those kind of fleeting thoughts that might spring into your mind. So not to make it smaller than it is or make it bigger than it is, but typically if someone is in a state of depression, they might, or more than likely, have these kind of little fleeting thoughts that can pop in. And it's about capturing that at the earliest possible point before they start developing any further, and it's really important for that GP to know that.
Absolutely. So it's about helping you developing a coping mechanism to manage that thought.
Yeah.
And for everyone in the room to feel confident that if they happen and they're starting to happen more often, you know what to do about it.
Yeah. So you can put some action in place.
Yeah.
And then what would be the actioning points that might come from that?
Sure. So typically somebody presents with low mood, we'll go through the questions, would establish all the symptoms and impacts on someone's life, and then we'll come out with a plan. And typically that plan may involve, if it's a first episode, a referral into free talking therapies, which we can refer people into, or lifestyle changes. In addition to that, if it's a second episode or if there are more moderate symptoms of depression, then we may consider medication as well.
And you'd also put a review in place and kind of help people and support them along that whole journey as well.
Typically, we'd like to see patients 2 to 3 weeks after they've first presented, so we can have an opportunity to review them. Absolutely.
Okay. Well, we're going to look a little bit deeper into those talking therapies, medication, and those other kind of social influence points that Dr. Raj was just mentioning there after Danelle Jones. Now, You Know What's Up on MKFM. Nice chilled out tune for Sunday evening. Danelle Jones, You Know What's Up on the MK Mental Health Hour. Tonight we're discussing depression. We've just established what maybe you could expect from going to a GP, but there are also some expectations that should be kind of set and measured, aren't there, John?
Yeah, and I've been on the side of the coin where I'm visiting a GP to discuss my mental health, and it's often, or there is an expectation or a perception that everything's going to be solved from that one appointment. More often than not, unfortunately, that's not the case. There is some things that certainly you might have to go away and begin to action and begin to do, and also from the GP side there might be certain things that need to be put in place. So I think that there's an expectation that even though you might have a great sense of relief, or it might be quite cathartic to finally be able to talk things through, it's potentially the beginning of a little bit of a journey around taking steps to recovery. So we just want to make sure that people don't have that huge expectation that it's going to be one appointment, I'm going to be better,
problem solved, everything's fine.
Unfortunately, these things are a little bit more complex. So there are certain things that a GP will help you get in place, and they typically or they could start with looking at a variety of different talking therapies. Is that right, Dr. Raj?
Yes, so the appointment can often be the beginning of a journey, and we like to make it as collaborative as possible. So once you've worked with the GP to establish whereabouts you potentially fit on that spectrum of low mood to depression, that it helps us make the right decision for you. We make that decision with you, not for you necessarily.
Yeah.
So it might be low intensity psychological intervention, as we call it. So that may be even self-help. We might refer you to a website or an app if we feel that's appropriate. It might be a computer-based program. We all too often think about talking therapies as lying on a couch with a psychiatrist, and that's simply not the case. That does also fit in there, but it's not the most common one by any means. We can be interpersonal therapy, so speaking to people and using a CBT approach where we challenge your thoughts and how they affect your emotions and how that in turn affects your behaviors, and it can often be a vicious cycle for people with low mood and depression. It can be group-based therapies, which is a little bit more higher intensity, and again, it could be CBT, it could be group-based counselling. Typically, these therapies will last up to 3 months, and you would be expected to engage once or twice a week in more intensive episodes, where it might be 3 or 4 sessions a month in other types of therapies. So there are a number of ways that talking therapies have a role to play in helping people with their depression. Again, not an immediate fix.
And we're so fortunate in Milton Keynes to have a variety of things going on. So we've got the Mix, which is a group thing you can head down to. I believe it's at the Point.
Oh, right.
People should probably check out just on Google if it's changed location, but I believe it's at the Point where you head down, speak to people who are in similar positions, have a coffee, have a biscuit, and just get out and speak to people who are in a similar situation. So even that can be considered talking therapies, because you're just getting out and discussing what's going on. And then also there are the mental health services that the GP can put a referral into. And I think in relation to one-to-one stuff, Mind offer one-to-one support, but also Arthur Ellis do as well. So we have our one-to-one mentoring. We do use CBT approaches quite regularly. We also have a look at lifestyle and a variety of other approaches that can be suitable for the individual, whether they're a child, whether they are a young adult, or whether they're elderly. So we have a variety of different ages and a variety of different issues that we support, so we can help with all of those different levels of support too.
So talking therapy is really, really helpful. Lots of different varieties of those. In some cases, medication might be kind of somewhere to turn.
Absolutely. So typically for a first episode, we may consider it, but not always. But certainly for subsequent episodes, it might be something we reach for a bit more quickly. Medications, there's lots of stigma attached around antidepressant medication, which shouldn't be there really, but we can understand why. So a couple of key things to sort of tick off. First of all, antidepressants will typically take 2 to 4 weeks before they start to have an effect. So you have to get that expectation with the patient right. For those first couple of weeks, people can often experience worsening symptoms, particularly around agitation and anxiety, and often it can even lead to suicidality, so people feeling suicidal and very dark thoughts. So it's so important that the patients are aware of that, the family and support structures are aware of that.
I was going to say the people around them
Absolutely.
knowing that they're beginning on this course of medication, so they might experience some changes, just to make sure the support's in there already.
Absolutely. It's so tough for patients during those first couple of weeks, and your GP is there to help you with that as well. Beyond that, it's important to recognise that you need to be on the treatment for at least 6 months after you're feeling better. Now, it's not addictive, and that's a common misconception around antidepressants. They are not addictive, but you do need to be on them for 6 months after you're feeling better. If you stop it any sooner, there's a real risk that you may relapse, and there can be other physical symptoms. So even if you are considering stopping for whatever reason, even if it's before or after 6 months, speak to your GP and come up with a plan on how to safely reduce your antidepressant.
I was going to say you shouldn't just stop one day either. Typically they kind of they'll wean off just to make sure that it's structured, it's stable, because there might be some issues if you just completely stop your medication straight away.
Absolutely, and we'll help you with warning signs that if this happens, this is when you need to put your hand up and get some help.
Yeah.
And there are also some lifestyle changes and things that you can do to help yourself. We're going to run through some of those after the script. The Last Time, which plays for you next.
The MK Mental Health Hour with Arthur Ellis Mental Health Support.
Sam Smith, how do you sleep on MKFM? So this has been the MK Mental Health Hour this evening, talking all about depression with Dr. Raj. Thank you so much for all of your helpful tips and advice this evening, Raj. You're always an absolute treat, and I know you've joined us before for the Changing Seasons. So many fantastic pieces of advice. If people have missed a few parts of the show, John, We got a bit of a summary for depression and everything we've kind of learned this evening.
Yeah, absolutely. So it's really important with depression, if you're starting to experience low mood, maybe your appetite might be changing, you might be changing concentration, sleep, different things that might start having an impact from your low mood. If it's just been a couple of days, then monitor it. Have a look at your lifestyle and see if you can implement some changes yourself. If it's been over a couple of weeks, it's definitely worth considering going to visit your GP. Beforehand, it's worth having a look at keeping a bit of a mood diary, so writing down how you've been feeling each day, how your sleep has been, how your appetite might have changed, and take that along with you to your GP appointment. That will really help the GP make some decisions on what course of treatment might be best suited to you. So they could go down a variety of routes and discuss the different options around talking therapies, whether that is digital advice, some app-based support. It could also be some one-to-one stuff or groups locally that they might be able to help you find. They could discuss different types of medication with you, what might be relevant, but also they will help you look at your lifestyle, look at the levels of alcohol you might be drinking, your sleep, and different advice around how you can alter those for the better. Absolutely, in terms of what Arthur Ellis do within the community, we are supporting adults with this on a sort of a daily basis. So if definitely go to your GP to have a conversation, but if somebody did want to reach out to us, if they do relate to anything within the show, then they can feel free to head over to our website, which is arthurellismhs.com. Either pop us an email, or we've got a self-referral form, and we have a 1 week turnaround for appointments, so we'll be able to see you and start helping you out straight away.
And the website is also where people can download and view an expert guide prepared by yourselves at Arthur Ellis, with all of those kind of helpful tips and advice that we've run through in the show this evening. So next week we're talking about fitness, aren't we, and resolutions?
Yeah, resolutions are probably going to start dwindling quite soon.
I would say so, if they haven't already.
I think I actually heard on the breakfast show that the 17th is the day that everyone stops.
Yes.
So we wanted to address some of the fitness resolutions that people might have. So we've got an expert guest coming on to talk about how people can get back on top of it and get consistent.
Fantastic. Well, join us next Sunday at the same time, 7 o'clock, for another MK Mental Health Hour.
The MK Mental Health Hour and MKFM.